Now, this is an important study that being related to people in endocrine disorders, including type 2 diabetes, may be associated with higher risk of miscarriage. So, what did researchers do? In Denmark, they analyzed data from national health registries to investigate the link between endocrine disorders, including diabetes, thyroid disease, polycystic ovarian syndrome, and miscarriage. They found that women with parents with endocrine disorders has a 6% higher rate of miscarriage, and those with a sister with an endocrine disorder had a 7% higher rate. Authors believe that the mechanism linking endocrine disease and pregnancy loss could be due to shared genetic background predisposing individuals to both endocrine disease and pregnancy loss. One potential mechanism could involve high risk human leukocyte antigens, which are called HLAs, which define the immune system to distinguish between good and bad. Now, HLA subtypes are known to be associated with several endocrine and autoimmune diseases, which could also be associated with pregnancy loss. Only 60% of miscarriages can be attributed to chromosomal abnormalities, and up to 40% of miscarriages could be due to genetic factors that influence the health of the mother. Researchers investigated data from the Danish health register from 54,394 women with endocrine diseases and 312,000 without endocrine diseases born between 1997 and 1993 who had one or more pregnancies. They discovered a significant correlation between endocrine disease in women and recorded miscarriage, which increased with recurrent miscarriage. Women with endocrine disease had a 15% higher risk of experiencing one miscarriage, a 31% chance of experiencing two, and an 81% increased chance of experiencing three miscarriages. The risk of recurrent miscarriage with two or three consecutive pregnancy losses was increased by 97% in people with endocrine disease. When you analyze family records, they showed that people with parents with type 2 diabetes had an 8% increased risk of miscarriage, and those with siblings with the condition had a 13% increased risk. This is quite an interesting study, and though while it is very much based on records, it is one of the first studies which shows that familial associations with many medical conditions may originate both from shared genetics and also environmental exposure, which could also be shared. And why is it important? It is important because I believe that when you talk to patients, it's encourage them to be more open with disclosing their medical history, get relatives to talk about their medical problems, because some of these are linked genetically and by sharing the same environment.